Francis, our next patient, has classic migraine headaches which respond to triptans. Francis, how many years have you had headaches for?
Basically, I've had headaches my whole life, but they've become a lot more severe in the last 5 years or so.
And what age were you when you had your first headache?
Around 12 or 14, when it was a really severe type headache.
Do you know when a headache is coming on? Do you have an aura?
Yeah, but mostly just before a headache begins, I start with a drooping eyelid, and that will start, and then the headache will definitely come on within a few minutes of that.
How often were you getting headaches, say, before you started medication?
Before medication, I was getting headaches at least 3 or 4 times a week, and they could actually last the entire day.
And with medication?
It's down to about once or twice a week now.
Do you have any precipitating factors that bring on these headaches?
Stress. I've really related it to stress. I have quite a stressful job, and if a particularly high stressful situation arises, then it will begin immediately.
Anything else that can bring on the headaches?
They might be a bit more frequent during a menstrual cycle.
Okay. Where is the pain located?
Pain is located mostly on my right side, and it'll start in the right side of my scalp and move on down my face.
Around the right eye?
Yeah, around my right eye, and behind both eyes actually as well.
And do you have any associated symptoms with these headaches?
Yes, I can get nausea, and actually will go into full-fledged vomiting. Those are mostly the symptoms. And numbness, a little bit of slurring of the speech. And basically it's all centralized on the right side of the face.
Do you have any visual symptoms with these headaches?
The visual symptoms I call them shooters and little jagged edges that go across the eyes.
On a scale of 1 to 5, with 5 being the worst pain, what number would you give to the pain that you have?
It's an easy answer. It's a 5 or 6.
Okay. Is the pain, how would you describe the pain?
It's a dull throb, and it just encompasses my whole head. It just throbs the entire time.
Do you have family members that have migraine headaches?
No, there's no family history of migraines.
None whatsoever?
No, there's not.
Have you had any studies, any neurodiagnostic studies done?
About 2 or 3 years ago, I had a brain MRI, and this is the time that the headaches were getting more severe, and it seemed like there was a change in the pattern, so the doctor recommended a brain MRI.
What medication are you taking right now for your migraine headaches?
At the moment, I'm on 2 medications. I'm taking 50 milligrams of Imitrex, which I take at the onset of a headache, and it relieves it.
Do you ever have to take a second 50 milligram tablet of Imitrex?
If the headache continues, or I should say if it comes back as the Imitrex wears off, which is in around 3 to 4 hours, I will take a second one, yes.
What medicines were you taking before you started on Imitrex?
Before Imitrex, I was taking Tylenol, literally hundreds of Tylenol, to where it was a really thought of concern. But since Imitrex, I don't take any Tylenol, because Imitrex is actually my savior now, and it's my miracle drug.
The second drug that you're taking, what's the name of it, and what dosage are you taking?
I take nortriptyline. It's 25 milligrams, and I take that just before going to bed. And I believe that this really has reduced the frequency of the headaches.
When you had a headache in the past, how disabling would it be?
Completely disabling. I mean, I would have to go into a very dark room. I would have to lie down, and even with the drapes closed, wasn't enough darkness for me. It was very, very light sensitive. I would put a pillow over my eyes, and I would just have to stay there, sometimes the entire day.
If you were at work, what would you do?
I would have to leave. I would have to leave my job and go home, or go into a dark room at the office, which is not very possible.
And now with using Imitrex?
At work now, if I feel that at the onset of a headache, I take the 50 milligram Imitrex. I sit down, try and have a quiet time for about 2 or 3 minutes or 5 minutes, and it actually begins to take effect, and I continue with my day.
So you don't lose any time from work?
I lose no time from work at all.
Francis, thank you for coming today and letting us interview you and getting the history of your headaches. I'm glad that the Imitrex is working, and I look forward to the medication working for many years.
Not near as much as I look forward to it continuing to work. Thank you.